The only option to move him to a full-fledged hospital that is equipped was to move him to Miami Valley, which was 30 minutes away. When they got him there, they said there was nothing they could do. It's horrible. It's a horrible act. It's an assault on our community. It's the way I feel. I mean, since when did a person's economic status determine the value of their life? I mean, our brother is dead because there's no hospital close enough that could assess what was going on with him. Perfectly healthy man, 58 years old, dead. Doctors, nurses, equipment, all of that makes a difference. And the people of West Dayton, Northwest Dayton, deserve it just as much as anybody in Oakwood, Centerville, all those other places. We want the same things. We're not asking for anything different here in this community. And for a Premier Network to block that is outrageous. Mm-hmm. Criminal. If it's not against the law, it just should be.
It reaches just more than me and my family. It's the whole community. We need a hospital in the Black community. Please.
I'm losing the vision in my right eye. I won't be able to drive much longer. For me to be able to get to medical facilities for services that I need, I will have to have somebody else get me there. I live a block away from Good Sam, around the corner really. In fact, I can see it out of my bedroom window. They made the decision because their demographics had changed. They were found themselves in the middle of a African American, mostly lower income neighborhood, and for years they'd been trying to attract clients, patients, service, people who needed service from as far away as Brookville, and that wasn't working. Those people didn't want to come into the city, and in my estimation, that's why they closed. But in doing so, they then decided that our side of town was not worthy of their services.
When they first started talking about closing Good Sam, the young lady on the TV said it's only 6 minutes from our area to Miami Valley. And it struck me that 6 minutes could cost somebody their life. 2 years ago, I had congestive heart failure. The ambulance came and got me, and they was getting ready to take me to the valley. They got to the end of the curve, whether to turn to the right to go to the valley or left to go to Good Sam. By the time the man got down there, he said, she's not going to make it to the valley. Get her to Good Sam now. And when they got me there, they were waiting for me. They took me straight in. They started working on me. My blood pressure has shot up to 298 over 190. And it hit me when that lady said 6 minutes, I wouldn't have lived. To me, it felt like they was looking at what it would cost to keep the hospital open versus what it costs to save lives. Now, I don't think it's going to cost them that much as far as the money, because they would be opening all these little satellite offices around here in these different areas. And I don't think Premier Health is really looking at how many lives they may lose in those 6 minutes.
Oh, I've had to switch doctors. I even moved so I could be closer to a different hospital because I have health issues. I have kidney failure. And I liked everything being in one spot. And now everything's scattered out. Like I said, one of them's all the way in Springboro. And everywhere you go, it's like 30 minutes, an hour drive somewhere. And I don't drive.
It's like a dagger in the side. Why stop another facility from coming in if you don't want to operate there? Why deny a medical provider to be there? I mean, it just doesn't make sense to me. I know it's about money. I mean, it goes back to civil rights, racism, and all that. I mean, it just, we have to fight. There's no question about it. We can't just sit back and just let things happen. We have to have a voice and we have to be heard.
You know, most people are elderly. They don't drive, are scared to even call for an ambulance because you're scared you're going to get the bill, So they probably, even if they were in a circumstance that they were in a death or circumstance, they would probably try to drive themselves, rather than even call an ambulance. My brother, Tyrone Russell, recently passed away. Around Christmas. The Good Samaritan had been there, then they possibly could have saved my brother's life like they did 18 years ago when he was ran over by a driver.
Why wouldn't Premier allow another company to reopen Good Samaritan as a new hospital?
Money. I think it's all about the money. Because I don't know why you wouldn't. They'd rather tear it down than to see somebody come in and put a hospital there, a real hospital.